So I am Linta, the CEO and co-founder of Vitract. I started Vitract from a personal experience, having a really hard time accessing gut testing. It can be so expensive. A lot of the gut testing today, you have to get through a practitioner. And there's just a lot of red tape in even the way test results are laid out. They read like lab reports, so they're not very understandable. There's not a lot of actionability that's built into the testing today. They might do a great job with taking a screenshot of the gut, but you really don't know where to go from there. And then at the end of the day, you end up paying a really hefty price tag for that. So those were all the main things that we were trying to tackle and build into improving in the Vitract gut test. So yeah, I'm super proud of the product that we've built. It only costs $150 US, and we can give you hundreds of biomarkers and give you a really good sense of intestinal permeability and sort of all of the keystone probiotics, commensals, pathogenic bacteria, everything that's in the gut there in relation to bacteria that's in the gut. Jenny, we met you a long time ago as you were just launching and kicking off your practice. I'd love to just sort of get an introduction on yourself. I know with your practice, you have a very strong focus on a disease state, and I'd love to hear more about it.
Yeah, it has been a while since we actually last saw each other. We actually never met face to face. We just been meeting virtually in all the times we've known each other. So that's actually really fantastically interesting for all those who's attending and doesn't know that. So for myself, I'm a lifestyle and culinary medicine physician, certified in Harvard Medical School, and have actually gone through my personal journey with a blood sugar control and actually reversing my own prediabetes. And what happened was about a year ago, I was having some vague symptoms of lightheadedness, bloating after eating, fatigue, hormone imbalance, and just feeling really blah a lot of the time. And I think it ties into what you're saying about your symptoms. That's a trigger for us to start asking some questions, to start looking into our own health. And that's when I went to my family physician, got some testing done, and found out that I was pre-diabetic, which was a complete surprise to me because I was already working as a lifestyle medicine physician. I thought I was doing all the right things. I was eating already mostly plant-based whole foods, exercising regularly, doing 5, 10K half marathon runs, doing yoga, all these things. And there's no family history. Like my grandparents are in their 80s and their blood sugar is fantastic. Right. And that kind of was a light bulb moment for me to look into a bit more about my own health and to look into the specific primary research and the studies behind blood sugar control and create a program for myself that I then use to successfully reverse my prediabetes in under 30 days. And that was the beginning of Kale Health Canada and the blood sugar defense program, the diabetes reversal platform that it is now today. And so I think we kind of both had similar journeys, similar stories about health challenges that led us to creating our respective companies.
Yeah, I think that's super fascinating. You took a Vitract gut test, and so did your husband. And I think what I found so fascinating about that was you guys live together, you eat the same diet, but both your test results were very different. Before we dive into the nuances of those differences, I'm curious to know, what did you learn from your test results that sort of gave you some insight into what could be happening in terms of the pre-diabetic sort of the journey that you were getting started?
Exactly. So I used you guys' kit as a part of my health plan to determine what is actually happening inside my digestive tract, because there's so much going on in our digestion, our microbiome, the bacteria that then influences how we process foods, how we process sugars, our metabolism, our hormones. They all are so interconnected. There's a direct link, almost one-to-one in many cases. And so by using the Vitract kit, I was able to have a better understanding of the specific types of bacteria that's inside my digestive tract, which, as you mentioned, it is different from my husband, even though we basically live in the same environment, eat the same type of food, both pretty active people. And I thought there would be more of a similarity. But for me, for example, there's this one type of bacteria called the Prevotella strain that is more common in people who have blood sugar issues, who maybe have diabetes. That's about 50%, 50% of the bacteria type in my gut, which is a huge number. And that was back in the day when I was dealing with blood sugar problems. And my husband, he had very small amount of that, maybe like less than 10%. It was something very drastically different.
And another one is Akkermansia, right?
Yes.
I think I remember when we were going through your results the first time, Akkermansia was at 0%, and we know that Akkermansia plays a really strong role in glucose metabolism, right? And the mechanism of action that happens there is essentially you have keystone probiotics like Akkermansia, Faecalibacterium, Rosevoria, and they essentially produce short-chain fatty acids. One of them, essentially, all of those short-chain fatty acids will go and then bind to G-coupled receptors. And what that does is it actually activates GLP-1 production. And then you have GLP-1, which then activates insulin production. So those things, that chain of events is very intricately linked. So you can see the connection between having no Akkermansia and then having a lot of glucose in the bloodstream.
Yeah, exactly. Yeah, short chain fatty acids produced by some of the gut bacteria through, for example, the fermentation of dietary fibers can definitely really just directly, as you mentioned, influence glucose metabolism, insulin sensitivity, all these things. And so, yeah, it is super important to, one, kind of understand what is going on inside you, and then two, to see what you can do to either improve the good bacteria or decrease the bad.
That's right. And then another mechanism of action that we see with short-chain fatty acids is it regulates a hormone called leptin. And leptin is what produces that feeling of being full. And that's really important. So if you're lacking a lot of that short-chain fatty acid production, it can actually have a lot of downstream effects that are really negative. Another impact that's really important with these short-chain fatty acids is they actually, your short-chain fatty acids are your butyrates, your acetates, your propionates. They essentially will go and they'll create this protective barrier. They'll line the inside of the gut lining. And what that does is it actually prevents dangerous substances from leaking out into the bloodstream, like your lipopolysaccharides, which then lipopolysaccharides, when they're in the bloodstream, can travel to the liver and sort of, again, make it harder for your body to self-regulate and down-regulate inflammation, and then effectively clear glucose out of the bloodstream and binding it into cells. So I think if you're not getting tested, you're not looking at these key short-chain fatty acid producers in the gut, it's really hard to get a picture of whether there's gut dysbiosis happening or not.
Exactly. And thank you for explaining the science in such great detail, because really, end of the day, our body is kind of a chemical process in many ways. There's actually many chemical processes going on at the same time. So it's almost like a science lab in some ways. And by really understanding what is going on with the bacteria, with our digestion, by using things like the ViTract testing kit, you can understand, okay, here is what my behavior is doing to my health. And there's so many other things like the continuous glucose monitors. That's another piece of the pie. So there's all these other health technologies out there now that really allow me as a lifestyle medicine physician to work with clients end of the day and put all the pieces of the puzzle together so that we can come up with a holistic health plan that's tailored for your condition, for your health goals, etc. because sometimes it does get a bit overwhelming with all the nitty-gritties, but really, end of the day, it's about having somebody who has either been there or who is trained in distilling all those informations into a way that is, one, applicable for you, and two, is realistic and sustainable.
Yeah, and Jenny, you have one of those backgrounds where you're Harvard trained MD, but then rather than sort of taking the traditional allopathic medicine route and setting up a practice and giving that a go, you actually then went and are you a sort of further certified in functional medicine as well, like IFM certified as well?
Yeah, so right now I am going through the process of the IFM functional medicine certification. So not yet, I'm not yet fully certified in that, but I am certified in lifestyle medicine. And I also do work with people who are struggling with weight loss as well as blood sugar problems. So I do have training and expertise in weight management as well. And there's so much interconnectivity between all these areas.
Yeah, that's right. And I think more and more people are interested in working with doctors that can go beyond your initial 5-10 minute appointment and really do a deep dive into your healthcare history, and then run all these specialized testing like gut microbiome testing. What has it been like working with your patients in terms of working with now a patient population who's a lot more educated and really is driving the demand for these integrative care products? Do you think there's less education to do on your part? Like, do you have clients coming to you and asking for testing and all these other things?
That's a great question. And I think it's a kind of a two-part answer. One is right now in our healthcare system, the way it stands, the tests that we do are based on the latest based on the recommendations, the medical society guidelines, etc. But sometimes they're not comprehensive enough for your specific condition. Sometimes you go to the doctor and you're told, oh, all your test results are normal. But yet you're still feeling a bit off. There is still something not quite right. And that's when other specialized testing comes into place, like the ViTract gut health test, the continuous glucose monitors, other hormone tests, etc. These are the other pieces of the puzzle that will maybe help you to answer the question as to, oh, what is actually going on with some of the symptoms? Because really, end of the day, your body is a litmus test. Your body is the one telling you something is working or something is not working. And so it's really great to go to a provider who has the training, who has the expertise, who has access to some of these resources to help you guide you along the health journey that you're on. And I do work with a number of clients who are, professionals, who are well educated, who do ask some really great questions because they're so engaged, they're motivated to get their health on track, or to stay on track, or to even optimize it for performance, for function, etc. There are also clients I work with who come to me having been exposed to, say, the latest social media trend or other things they may have heard from certain influencers, etc. So there is that some of the health myths that I have to then go through with them and demystify and almost go through a reprogramming phase, so that then we kind of start afresh and start on the right track.
Yeah, I actually hear this really often in my conversations with practitioners. Is you'll have clients that are like, oh, I'm doing this detox protocol with this practitioner, and now I'm working with this practitioner, but I still have a few months left of that other protocol, and I paid for everything, and I want to keep doing it. See a lot of like colon cleansing and all these other things that people are doing. So it can be really challenging when you get a new patient to say, okay, let's start from scratch. Let's run all the tests again. It certainly helps if the testing is affordable to be able to do that. I will say another thing that I've seen that's been a game changer for clinicians is being able to retest. If you're running a test for your client that's like $400-$600, it's hard to say like, okay, let's rerun this test every couple of months and track progress over time and see if we're actually making empirical improvements to these biomarkers or not. And so that's why price can be a huge deal.
Exactly. Exactly. Price is definitely a huge deal. In a lot of cases, because we do want to get the latest health data of what's going on in your body. So having that affordability piece, for example, through the ViTract kit, it's great for that. We can do recurrent testing so that we can follow things every 3 to 6 months, because it does take a while for your digestive tract to change, to shift, to make some of these adjustments, etc. And so to have that ongoing health data piece is really important for just having that sustainable behavior, have sustainable lifestyle, and that's just going to benefit you in the long term.
Yeah. And are there consistent themes of questions that you're seeing coming up from clients regarding the gut microbiome that you think would be beneficial to sort of go through?
Some of the common things, you probably heard this many times as well, are things related to bloating, right? A lot of people, they come and they hear things maybe from other providers or online, their own research, etc., about SIBO, right? Small intestinal bacterial overgrowth. They might have
Yeah.
gone to a naturopath. They may have done all these other things, and unfortunately, they still have the symptoms. But
Yeah.
that's because we don't actually know what's going on, right? They haven't gone through the testing. They don't know if it's bacteria A versus B that's causing the problem. Because sometimes they can all produce a lot of hydrogen sulfide gas that causes bloating, but you don't know, am I doing the exact right things to change the bacteria profile so that I don't have the symptoms? Or am I actually doing something that's counterproductive?
Right. And one of the interesting biomarkers for bloating is methanobrevibacter. It's essentially what produces methane in the gut. And that is what can cause, one of the things that can do is it can slow down the transit time. So that can lead to of food moving along the GI tract that can cause constipation, but it can also cause a lot of bloating because there's a lot of methane production that's happening in the microbiome.
Exactly. Yeah, and just the way that we live our life these days, and especially the type of food that we're eating, a lot of people are chronically constipated and we don't even know it. And we think that it's almost normal to go maybe once every 2 days, or maybe a small amount of once
Yeah.
a day sort of thing. But yeah, it's actually very different from what our ancestors used to do.
Yeah.
And that is just kind of the tip of the iceberg right there.
Yeah, I think you're bringing up a good point that some people who've had chronic health issues, whether it might be inflammation or GI upset, they almost just have become so accustomed to feeling that way that they think that's just how it is until they go through a certain big event or the symptoms get exacerbated and they're forced to say, okay, what are my options? What can I do? But some of these chronic GI issues people have been having for a really, really long time.
Exactly. And it's because the onset is so slow, right? It's not a huge 180-degree or 360-degree change from one day to the next, but because of the gradual onset, we kind of just ignore it and put it on the back burner. I mean, even for myself, when I was having the vague symptoms of poorly controlled blood sugar, fatigue, and low energy, etc., I just chalked it up to overworked, to maybe I was being burnt out as a result of overwork during COVID or something. And it wasn't until enough of the symptoms kind of started showing up that I decided, okay, well, now it's time to look into it a little bit more. Yeah.
Yeah, that's right. Some other questions I have for you. I'm curious to know whether after you took the test, you implemented some of the changes, did you see results? Did you actually feel better? And how did your journey go after that?
Yeah, for sure. And I really loved the tailor recommendations that's accessible through the ViTrack platform based on my specific health gut profile. And I looked through the recommendations and I was already doing some of those, but I was surprised to find a couple that I did not really account for. For example, I started integrating more beans and legumes and also whole grains into my diet. Because for a while I thought, oh, okay, maybe cutting out some of these things because they have carbohydrates, as we all been told, is good for us. But it's actually counterproductive because we need to have all these complex of whole grains and complex fibers into our diet to help with producing or fueling the strengths of the good bacteria in our gut that then works together to help with some of our other symptoms and hormone regulation. So that's one of the, I guess, key things that I started doing as a result of using the ViTrack kit and finding out more about my gut health. And nowadays, I try to eat something, whether it's beans, lentils, legumes, or something like that, almost every day. Maybe I try to do it every meal, but sometimes, of course, you can't really have that for breakfast. It just doesn't really, having beans for breakfast, at least for me, it's not really a very common thing, but at least once a day, I try to have something like that so that I keep my gut healthy, my body just feels so much better. And for the beans, a lot of people have the question about, oh, but beans causes bloating. And yes, it does when the other things in your gut aren't working very well in conjunction with the beans and stuff that you're eating. So it's really about getting the right team of bacteria together in your gut to work together.
Yeah, that's right. And I think going back to your results a little bit is like when you find that a certain biomarker is at 0%, there's nothing you can do in terms of dietary interventions that can bring it back. Like you literally have to take a probiotic, you have to reseed it in the gut, and then you have to feed it so that it stays there. Think about the microbiome like a jungle. And I think that's so fascinating because if you're not running testing, you just don't know.
Yeah.
And you could go back and forth with all the different types of dietary interventions, but you wouldn't know if that's making a difference or not.
Oh, for sure. And actually, that's another good point in terms of the probiotic and prebiotic profile on my gut health. And so I started using this combination of pre and probiotics that also I think has really helped to increase the good bacteria from 0% or almost near 0% for some of them to a good range. And so it really, and then there's so many other types of probiotics that's on the market, right? So you have to kind of figure out which is a specific strength that would work for you.
Right. Yeah, and that's one of the things we do in our tests if we see a biomarker is low or high, you can click into it, you can sort of drop down and look into how you would what exact strain would help increase that specific biomarker. And then another thing that we do, and this is exclusively for our practitioners. So Jenny, I don't know if we've sent this to you yet, but let me know if we haven't. It's essentially this list that we've amalgamated of all the probiotics on the market and identified them as either class 1, class 2, or class 3. Class 1 is like your gold standard, double placebo controlled study. So it's essentially the gold standard of literature. The second one is it's double blinded, but there's no placebo control. So it's good, but it's not great. And then class 3 is essentially based on expert opinions, what we see in terms of probiotics to work. And then we have that list, we send it out to practitioners. We get no kickbacks in terms of, having a partnership with the probiotics companies that are making these products. The reason we do that is because we want that sheet to be the holy grail of these are good products that you can recommend to your clients. And irrespective of whether you do or not, it's just an educational resource.
Oh, fantastic. Yeah, I'd love to have a copy of that.
Yeah, I'll send that to you.
Thank you.
And then another thing that I wanted to get into was commensals. So everyone knows what a probiotic is, right? Probiotics are good strains of bacteria that live in your gut, and they produce beneficial things like short-chain fatty acids that we need. I don't think most people are aware of what commensals are.
Yeah, so I mean, commensals is basically a fancy term to say bacteria that's in your gut that can produce good things for your body, so good byproducts, but in excess amounts sometimes they could cause problems. Like one of my commensals, if I remember correctly, is the Prevotella,
right.
And that Yeah, and that's the one that's over 50%, or close to 50%
Yeah.
of my bacteria in my gut. And that's been associated with poor blood sugar control, insulin resistance, people's diabetes, prediabetes, all these things,
Yeah.
etc. And so in moderate amounts, in small amounts, it has a great function. But if it's too much, if it's kind of like anything, if we tip the scale too much in one direction, it causes problems, right? It's really about moderation, balance, not only for our lifestyle, our nutrition, but that also feeds into the balance in our gut, our bacteria types.
Yeah, and another interesting point on that is in the gut microbiome, you only have a finite amount of space. So if you have Prevotella that's taking up 50% of space in your microbiome, that means all the other species that should be there are now fighting for and competing for the rest of the space. And that's not good.
Exactly, yeah, for sure. And then we only have, like you're saying, so much space in there, and each type of bacteria has their own function, help us in their own specific way. And so we really need to have a balance so that they can work together as a team to help us stay healthy.
Yeah. Well, I know we're coming up on the half hour. Thank you so much for being here. I think one of the things that we wanted to really highlight is the microbiome is very, very, very complex. And the main thing we've tried to do with this test is simplify it for clients, but predominantly for practitioners, because I really do believe that microbiome is super important, but it's still one piece of the entire health puzzle. And so the best thing to do is really work with a practitioner who can help piece it all together for you. Jenny, for your clients, we've already set you up so that you're able to start offering the ViTrack gut test. For anyone else that's interested, or if any of your clients are listening in, how can they, if they were interested to access the testing, how would they do that?
Yeah. So if they want to access the testing, it's super simple. They can go on the ViTrack website, and they could use my code is basically Gen10, JEN10, and then they can access the kit for 10% off, which is great because the kit is already so affordable. So even so with additional 10% off, it's just going to make it basically if not the most affordable option on the market, definitely one of the top ones. And with that, you could do repeat testing every, say, 3 to 6 months to see how it changes, how your gut health evolves over time. And if anybody has further questions, they can always get in touch with me through Instagram, through my website, which is kalehealth.ca. They can book in a free consult with me, and then we can kind of go over things to make sure that we get you set up correctly.
Awesome. Thank you so much, Jen. I'll send you over to the resources I promised, and we'll see you next time.
Thank you very much. You can take care.
You too.
Okay.
Bye.